Welcome to Community Matters. I'm Jonjy Ananth, and today I'm talking with Naranja Jr., MD, JD. He's a physician, orthopedic surgeon, and also practicing attorney in personal injury at the Diller Law firm in Boston. Dr. Naranja, thanks so much for joining us.
Oh, thank you for having me, Jonjy.
So, Dr. Naranja, can you tell us a little bit about your personal story of how you became an MD and a JD?
Well, it's kind of interesting what happened. I grew up in a family in which both my parents are physicians. So as you might imagine, I had a strong influence in terms of going into medicine. I ended up deciding to go to medical school first, not having any inclination of wanting to be a lawyer at the same time.
Yeah.
I went to medical school at Georgetown University in Washington, D.C., and after that, I did a residency at the University of Pennsylvania in Philadelphia in orthopedic surgery.
Wow.
The United States Air Force had actually paid for my medical school through an Air Force scholarship. So after I completed my medical school and residency training, I did a 4-year active duty term with the United States Air Force as an orthopedic surgeon.
Wow.
Once I completed the 4-year commitment, then I actually went into civilian practice, and I had a orthopedic surgery practice in Maine for approximately 12 years. After that 12-year time frame, we'll probably talk a little bit more about it later, but I decided to change careers.
Yeah.
That's when I decided to take the LSAT, which is the admissions exam for law school, and I did fairly well on the LSAT and was accepted to a number of law schools.
Yeah.
I decided to go to Northeastern in Boston for law school for a number of reasons, one of which being I wanted to kind of stay close to Maine and the family that I had there.
Yeah.
I then completed the law school and subsequently joined the Diller Law firm, which specializes in personal injury law.
Wow, that's really interesting. What did your family say when you told them that you wanted to be a doctor and a lawyer?
Well, to be honest, they thought I was crazy. I think, I mean, both of course are well respected disciplines, but when you at first glance they look like two very different types of practices, but in actuality, and I learned as I went through both disciplines, they're very similar in terms of how the philosophy and the principles of approaching people.
Yeah, I see. Like, how do you mean?
Well, in both disciplines, the similarities really converge in terms of how we want to try and help people. We want to help people through their problems, whether it's through some kind of injury or illness, or whether it's through some kind of legal matter.
Yeah.
At its base, both disciplines try to do that.
Yeah, that is interesting, and definitely something that I think that people like to. That really draws the two together. When you're practicing, you're drawing those two worlds of your life together.
Absolutely, and I think that one of the things that I try to do is I don't want to throw away all the skills that I learned from the practice of medicine. So what I've done is try to overlap some of those skills in terms of relating to people in a way from a physician standpoint as well as from an attorney standpoint, and try and then give my best to whoever our client is.
Yeah, that's excellent and very good to hear. What is it like to be a practicing attorney?
Well, it's actually fun, believe it or not. Yeah. In changing from the practice of medicine to the practice of law, everything is fairly new for me.
Yeah.
So, although I apply a lot of the discipline that I've learned from the practice of medicine to law, there are still a lot of new things for me to learn. And as you know, Jonjy, it's great to keep learning new things. It keeps life fresh, and it makes you satisfied in terms of what you're doing.
Yeah, and very true, definitely. And as they say, right, medicine and law are the two learned professions. So you are definitely learning. And there's always that expression that to be great, you stand on the shoulders of giants. You have a great coach. Can you share with us the personal story of someone who inspires you? If you're just joining us, this is Jonjy Ananth for Community Matters. I'm talking with Naranja, MD, JD. He is a physician and a practicing personal injury attorney at the Diller Law firm in Boston.
Yeah, that's a great question, Jonjy. I think that one of the people that inspired me, especially in growing up, was my father. My father came from the Philippines, immigrated to the United States. My father went to medical school in the Philippines, and his story is one that anybody could look up to. He came to the United States with really nothing, and then he completed his residency outside the Boston area, and raised a family through all his hard work. And in addition to kind of continuing supporting his family back in the Philippines, he's really an inspiration as to how he made his family first and how he really lived the American dream in terms of the hard work that he put in.
Yeah, that is very true. Came all the way from the Philippines, and it must be challenging, right, to be the immigrant experience, plus to become a physician and to work in the Air Force as well.
Right. He did join the Air Force, and he represented the United States after coming from the Philippines. It's really a story that I look to emulate.
That's beautiful. And I know you had also been in the Air Force, and you had mentioned to me once, the two of you found yourself working together sometimes, right?
Right. So it's a kind of funny story. My father and I were actually stationed at the same Air Force base, and my father would always come up to me and tell me that I had to salute him wherever we were. It was one way that he continued the discipline beyond my childhood into adulthood.
Well, we were always our parents' children, as
that's
they
right.
say.
That's always the case.
Oh my goodness! And of course, without naming any names, can you tell us about one of the strangest cases you've had to deal with?
Well, there are probably a number of, and you're talking from either the medicine or legal field.
Yeah.
I mean, let me start with the medical field. Orthopedic surgery is one of those practices where you see a lot of trauma, and you see anything and everything that can happen that happens by accident. And so during my residency, I actually saw a number of traumatic injuries in which, for example, on a construction site, pieces of wood can be flying everywhere when you're cutting the wood and doing all kinds of building, where people actually had pieces of wood sticking out of their body through and through. I've seen a number of gunshot wounds. I've seen a number of really horrific type of injuries that you may have maybe seen on television and didn't think they were real, but those are some real injuries that can happen to people.
Wow, like impalements with
impalements with wood. I've seen traumatic amputations coming from the arm, coming from the leg, and now with how motor vehicles are really traveling very fast these days, we're actually seeing survivors with high-speed injuries because airbag deployment can protect people, but it doesn't always prevent the injuries that occur with those high-speed motor vehicle collisions.
I see. Is that because when you have the impact, right, you have those several layers of impact, so your body hits the car, but then your organs inside your body hit the front of your body?
Yeah, that's exactly right, Jonjy. So we're seeing a lot of post-traumatic head injuries, concussions, internal injuries. Whereas, it's great that we have the technology with the airbags and people wearing their seatbelts more frequently. But at the same time, when you see these high velocity and high energy injuries, you're having to deal with some really bigger injuries too.
Wow. Yeah, that's very interesting. I remember you had mentioned to me once about a new technology out there involving bugs, because I of course I know virtually nothing about orthopedic surgery, but I know that you had mentioned to me about how when people come in with amputation injuries, right, they get a limb cut off, and you said that viability of the limb is very important, the circulation.
Correct. So with amputation injuries, I've been involved with some amputation injuries in which we've had to use some special treatment mechanisms to see if we can help the limb get viable. And although this might sound maybe an old way of doing things or kind of actually gross, we've actually had to use leeches in the past with reimplanting limbs.
If you're just joining us, this is Jonjy Ananth for Community Matters. I'm talking with John Naranja, MD, JD. He is a physician and a practicing personal injury attorney at the Diller Law firm in Boston.
And the idea or the scientific basis of using the leeches was basically to help with the blood flow. As you know, leeches basically what they do is they suck your blood.
Yeah.
So when we reimplant a limb and reattach let's say a piece of your arm back to the body, we want the blood flow to get to the end part of that transplant.
Yeah.
So in order to help with that blood flow, the leeches actually can provide some of that suction from their their mechanism to help with the blood flow.
Huh. Well, that is quite a useful technique, and at the same time, quite interesting, I'm sure, for the nurses who have to be coming in and changing the leeches.
Yeah, I think that when I was at the time that I was in practice using the leeches, fortunately or unfortunately, I wasn't the one doing the changing of the leeches when they had to be changed. It was the nurses, so they were really good.
Oh, I'm glad to hear that. I can just imagine giving that order at 2 a.m, right?
Right. Change leeches.
Oh, so I'm just curious. You talked about how, being a doctor and being a lawyer is relatively similar because of, you're both trying, you're trying to help people at the end of the day. What are the major differences that you find in being, in being a lawyer versus being a doctor?
So the major differences in terms of each practice really has to do with the concentration of the content in which you're trying to maintain your proficiency. In other words, in the practice of law, more specifically personal injury law, we have to continue to maintain our proficiency and understanding of the laws as they continue to change. Certainly in medicine, things continue to change, especially the technology, but in essence, the medicine just it doesn't change, I think, as fast as the law does. Whereas the law, is basically changing minute to minute with all the new litigation or any kind of legislative matters that happen. Medicine isn't quite as fast in that sense.
Yeah, that is interesting to think about, and you're right. I guess the arm is always where the arm is.
Right. The anatomy is the anatomy. When I studied gross anatomy in medical school, it's not that much different from when now the new medical students are studying it now.
Yeah, that is true. Interesting to think about. And how hard, of course, I'm sure this is on every young person's mind in the country. How hard is law school compared to med school?
Jonjy, that's a great question. And I'll tell you, my experience is I don't know if it's going to be accurate for the young people who are listening, but basically when I went through medical school, it's been quite a few years, but when I went through medical school, we didn't use technology as much. So a lot of my note-taking in class was all handwritten, okay? But when I went to law school, things had changed so much. When I first got to my first class, everybody had their laptops open and was taking notes on their keyboard. And I was looking around, and I still had my pad of paper with my pen. So I really had to adjust quickly. So I went out and got my computer, and then I started, taking my notes on the keyboard.
Wow.
But really, the difference is probably a matter of duration. Remember that for medical school and to become a practicing physician requires not only medical school, which is 4 years, but also whichever residency that you go into, there's a number of years that go into it with that. Yeah. So in orthopedic surgery, I had to put another 5 years or so for a total of 9 years before I could really start practicing medicine. Wow. The difference with law is that law school is 3 years. And so after the 3 years, you're kind of thrown out there and, okay, go start practicing law. Yeah. So I think that the duration of each discipline, there's a difference. Yes. Personally, I favor a little bit the residency side of it, only because it gives a little bit more of a transition for somebody interested in medicine. But at the same time, it does require a lot more time commitment for those who are interested in that discipline.
I see, and it's just it's a larger time commitment, but they give you that transition.
Correct.
Oh, wow, that is fascinating, and such a fascinating perspective from somebody who has experienced both.
Right. Well, one of the things that, in terms of my practice at the Diller Law from doing personal injury, I think the advantage that I had was having that previous life experience as a physician, which almost was my residency for law too. Yeah. Because in personal injury, we take care of individuals who have been hurt through no fault of their own, and we try and help them to get some type of recovery from that. Yeah. As a result, with my experience as a physician, I can better understand those particular clients and the injuries that they sustained, and perhaps help them in terms of getting their recovery.
Yeah, I can imagine, right? Compared to the regular lawyers, If you're just joining us, this is Jonjy Ananth for Community Matters. I'm talking with John Naranja, MD, JD. He is a physician and a practicing personal injury attorney at the Diller Law firm in Boston. You know how the medical records, and you know how, what the physicians are probably thinking, if you're, arguing in a malpractice lawsuit.
Right. And there's a certain, each of the disciplines has their own language, so to speak.
Yeah.
Just like there's, Spanish and French. And there's also the language of medicine. There's the language of law that I feel like I'm fluent in both now, and that I can speak to both sides.
Yes, that's true. And I know in medicine in particular, there's a lot of Greek and Latin.
That's right.
Yeah.
That's right.
Sometimes people will say it's all Greek to me. Well, sometimes it is.
Yeah, that's right. That's right. Yeah, exactly.
It's very interesting. And I guess because after studying so much and learning so many interesting life lessons, what is the most important lesson that you've learned in your experience as a doctor and a lawyer?
I think that one of the things that I try and also pass on to my children is I like them to take those opportunities to continue to get your education.
Yes.
Education is the basis for any opportunity that you want to get into. I think that education is really what's going to open those doors. Yeah. Now, certainly there are a lot of successful people, a lot of very knowledgeable people who don't have dual degrees or don't have one degree. Yeah. But I'm not suggesting that you need to have 1 or 2 or 3 degrees. Yeah. But what I'm suggesting is that if you can continue to engage yourself in expanding your education and continuing to learn more, I think that's only going to put you at an advantage in the future.
Wow, education, that is a valuable lesson. And do you have a piece of advice for America's young people in particular?
I think that America's young people, there are so many opportunities out there that especially with how technology is and how especially how the information technology has given us a lot more access to different things. Yeah. I think that the advice I would give is to take advantage of those opportunities and the technology that you're given, because there's really a lot out there for you to see.
Yeah. Take advantage of opportunities. That is and it's so interesting to think about. I know you have taken advantage of opportunities in that you've done so much in your life, and I know you were in the Air Force also, and you have a large family too. You had mentioned your kids.
Right. So I have a blended family, and so altogether I have 10 children. So we just actually had them all over for Christmas, and it was a huge gathering, and it was a great time. But it's definitely, we have a huge family.
Let me give a shout out for them. What are their names?
So my oldest is my wife is Kelly. Yeah. My oldest, who's 28. So the range of my kids is from 28 all the way to 8. My oldest, he's Rogelio the third. Yeah. My second is Gabrielle. Yeah. Third is Dante. Next is Antonio. Yeah. Next is Cristo. Next is Nico. Next is Riley. Next is Griffin. Next is Genevieve, and next is Tobias. I think I got everybody. I'm sure I did.
Beautiful. I just want to give a shout out to all of you, and you definitely have a wonderful father.
Oh, actually, one more thing is my granddaughter, who is now 8 months old. Her name is Luciana. Luciana.
Oh, how sweet. And to think about, to be in so many different fields. So I guess they say, what is your most important job? Well, I'm a doctor, I'm a lawyer, but I'm a father. And would you say that's your most important job?
Oh, yes. I think that for me, it's faith, family, and friends, in that order. So yes. I'm a strong believer in. It's also about our relationships, and the people closest to us are the ones that matter. But obviously, we're here for a purpose that's bigger than just ourselves. So that's I think that's important to remember.
Yeah, that is very true. I am, of course, curious because I want. They say being in the operating room is itself a challenge. You have to wake up early in the morning, and you're operating pretty much all day, right? And you were in the military on top of that, so that requires an additional level of discipline. What is it like working in the courtroom? If you're just joining us, this is Jonjy Ananth for Community Matters. I'm talking with John Naranja, MD, JD. He is a physician and a practicing personal injury attorney at the Diller Law firm in Boston.
So that's a great question. I think that so there's kind of a parallel between the excitement of being in the operating room and doing surgery and performing surgery. There's a parallel with law in terms of being in the courtroom and arguing a case and analyzing and really being diligent for your client. Yeah. Certainly there's a lot of mechanical types of skills that are needed in the operating room, but at the same time, there's a lot of analytical things that are happening when you're performing surgery in terms of finding the pathology or finding out what's wrong when you're doing the surgery and trying to put things back together, especially in orthopedics. Orthopedics, remember, is about broken bones and those kinds of things, so you're putting a puzzle back together. Yeah. In the courtroom, it's very similar in terms of that requirement of an analysis to make sure that your arguments make sense and they're logical and they're getting put together just like a puzzle in the operating room. Yeah. Because when you put the arguments together and they make a lot of sense to not only the judge but the jury who's listening to your arguments, then that's really satisfying in terms of helping your client.
I see. So it's a lot like reconstructing, a skeleton.
That's correct. Because for in the courtroom, the evidence is kind of, think of those as your bones. Yeah. And when you're putting those bones back together again and putting them back together in the right way so that it makes sense, that's really going to be the best thing that you can do for your clients.
Wow. Can you recall an exciting courtroom moment when I guess they say, I always go back, I think of that movie, because I don't know much about being in a courtroom, but, that movie, what was that with Tom Cruise? And he says,
A Few Good Men. Yeah, A Few Good Men, right?
Have you ever had a moment like that where you, kind of a dramatic courtroom moment?
Well, Jonjy, that's those kinds of courtroom moments. You remember that the courtroom is you've probably even seen on TV and in the movies. The courtroom is it's almost like a theater because you're playing to your jury and you're trying to make sure that you're making a connection with the jury. Yeah. Just like actors and actresses are trying to make a connection with their audience, the attorney, when they're making their presentations to the jury, is trying to make a connection to the jury. Yeah. So I can't really pinpoint one particular time frame, but there are certain times when you feel like, and maybe it's hard to understand unless you were put in that position, but you're making that connection with the jury where they know exactly how you're thinking and they know exactly which way you're headed. Huh, it's that kind of connection that you can make with the jury that's just awesome.
Wow, it's like an interpersonal connection, like an aha kind of moment.
That's right, and that's really, I think, when the Few Good Men, that moment when he said, what was the order again?
He said, "Who ordered the code?
Who ordered the code red? I ordered the code red." That's when you feel like, when the jury feels like, they hear that I ordered the code red, maybe not in those particular terms, but you basically made that connection.
Yeah. Wow. And it's interesting too, because very similar to medicine, I'm sure, right? When you're trying to make a connection with your patient.
That's right.
And I'm sure when you were dealing with orthopedic cases, you had to work with the patient in the beginning to explain to them the surgery and make them comfortable enough to, go through different procedures and establish a relationship with them.
Yeah, absolutely. And not only that, it also, on the medical side of things, it also has to do with making that diagnosis. All right. So sometimes, the diagnosis is clear. You can look at the X-ray and I can see there's a fracture on the X-ray. But it sometimes when you have patients come in and you don't know exactly what's going on, and then you're doing your workup and you're doing your evaluation, you're getting all your studies done, and finally you get that last piece of the puzzle, and you find out, that's what the diagnosis is. That's a great moment too.
Wow.
That can be a very satisfying thing to be able to diagnose somebody who hasn't yet.
If you're just joining us, this is Jonjy Ananth for Community Matters. I'm talking with John Naranja, MD, JD. He is a physician and a practicing personal injury attorney at the Diller Law firm in Boston.
nobody's yet figured out what is it that's going on.
Yeah, that is true. A lot like that show. What's it called? With a house.
Yes, exactly.
Detective show,
exactly.
right?
You know, I think that's probably why a lot of those types of shows are very popular, is because people like to see how things get solved. Yeah. That's probably also what drew me to what looks like different disciplines in terms of law and medicine. You like to see how things get solved.
Yeah.
And that's you can definitely do that in both the practice of law and medicine.
Absolutely. Like you said, constructing the case. You have to construct the argument in such a way that it makes logical sense, so
Correct.
that you can connect with the jury.
Right. Right.
Wow.
Exactly.
Thank you. Yeah, it's very important to think about, and definitely I'll be looking up to you. I think if you ask any young person, they will be looking up to you and just the amazing things you've been able to accomplish.
Well, thank you.
And especially not just in the professional side, but you've also accomplished a lot on the personal side as well. Having such a large family, serving your country, and being someone who is able to excel in whatever he does.
Well, thank you. The other thing I do want to mention, Jonjy, because I don't think we mentioned this, but the way that we met was through the Asian American Commission. So I do want to kind of give a little bit of a shout out through how we met.
Yeah.
It's an organization in which we're, basically advocating for Asian Americans in the Commonwealth. I also shared with you that I'm also a member of the Philippine Medical Association of New England, which is a nonprofit organization in which we're trying to help the Filipinos in both the Commonwealth as well as in the Philippines in terms of service, community service, and charitable activities through that organization as well.
That is true. Yeah, I know that you're involved in a lot of different organizations, and it's nice to think about as well. And we had met on the Asian American Commission, a great organization that's working to advocate for Asian Americans and Pacific Islanders in the Commonwealth, and to think about how all of these different aspects of your life tie in together. Service on boards and commissions, and serving your country through the Air Force, working as a lawyer, working as a doctor, being a father. It's just really something to admire what you've done.
Well, thank you, and that's why I appreciate you allowing me to come on your show and just kind of share some of my experiences, because ultimately we want to try and have a benefit for our listeners and in any way that we can.
Yeah, absolutely. Dr. Naranja, I'm out of time.
Oh, that's okay. That's okay. I have to go home. Remember, I have 10 kids.
Yes. That is a good reason.
Okay. Sounds good.
It's such a pleasure to have you with me.
Thank you so much for having me. I really appreciate sharing my time with you.
Thank you.